Good day, my dear students. Welcome to Spotters in Pathology. The two spotters that I had chosen for this session are inflammatory nasal polyp and rhinosporidiosis. Seemingly simple, but yet let us see how well we can explain them. Knowledge is a treasure, but practice is the key to it. A wonderful saying. I would like you people to always have these in a corner of your mind. What we are seeing in this picture is an inflammatory polyp. What is a polyp? A polyp is a lesion that projects above the surface. It can be above the mucosa, above the skin, or above the gastrointestinal mucosa, whatsoever. So it is a gross finding. In this case, we are finding a polypoid lesion that is abutting and obstructing the external nerve. Sometimes we can have it dripping posteriorly, which is called an anthracoanal polyp. These are questions for you in ENT. Definitely, these will not be kept for the exam, but can be part of a chart that is being constructed in various centers. So you will have to define a polyp and you will have to describe. It can be pedunculated, it can be sessile. This is an important diagram for the subsequent histology slides. When we talk about the nasal epithelium, or for that matter, the epithelium of the upper respiratory tract, we find that it is not a single cell. There can be a cuboidal epithelium as this. There can be goblet cells having multiple secretory vacuoles. There can be a ciliated epithelium as in this case. And sometimes we will be finding non-ciliated columnar epithelium. Many of these will be present and these are all represented in the slides. As usual, we find that there is a basal layer over here which can mature into these cells. This is not important for your spotters, but without this, you will not be able to understand. Lower down, there will be the stroma or the supporting cells, and then there will be the blood vessels. So this concept we shall have in mind. Look at this slide. I find that there is a lining epithelium, which is composed of columnar cells. Sometimes I find that the cells may be piling up on each other. So we will call them as pseudostratified columnar epithelium. The pink line that I'm seeing is the basement membrane and the underlying collagen. So the epithelium is well above the collagen that is there. Lower down, I'm finding some whitish areas and the cells are all widely separated. So this wide separation of the cells indicate that it is edema. Edema is basically a separation of the cells and there is accumulation of the fluid in the interstitium. Third one is inflammatory cells. Look at the cells over here. Dark cells and then there is a pinkish cytoplasm. I will not go into the nature of it, but there is an inflammatory cell. So there is a lining epithelium, there is an edematous stroma, and there are inflammatory cells. So the diagnosis obviously is inflammatory polyp. Look at this one, it is varied. In some areas, I am finding this so-called columnar epithelium, but here I am finding basket of cells which are filled with secretions, the goblet cells. So the goblet cells are here, columnar cells are here. Again, the same old story of intact basement. There is a fibrocollagenous stroma. Stroma means always it will be pink in color or eosinophilic. That is what I am seeing. And there are inflammatory cells. Look at this one. if you people observe it carefully, there are some pinkish cytoplasm that I can make out. If it is not clear, have a look at it. So there are many a cell that is having a eosinophilic cytoplasm, and it is none other than eosinophils. Also, there are many small dark cells, namely the lymphocytes. This again is a higher magnification of the goblet cells and the columnar epithelium. Hope it is clear for you people. Look at this picture over here. I would like you people to kindly identify these components. In one, I am finding again more of secretions. In another one, there is pseudostratification. Any of it can be kept for us. So, in this case, it is obvious that the cells are predominantly pink in color, though they are small. So, this is what we are seeing. I am finding eosinophils in this here, and there are some lymphocytes. Also, in this case, I find that the clear space. So there is edema. And there are a lot of this dark blue cells, which are none other than lymphocytes. And look at the vessels, blood vessels, they are congested. Congested means stasis filled with blood. So you are able to see the lining epithelium, eosinophils, lymphocytes, plasma cells, edema, congestion. Definitely your diagnosis will be inflammatory polyp. Now I'll go on to another one. Again, I'm going to the same story of cuboidal epithelium, goblet cells, ciliated columnar, non-ciliated cells, and pseudostratified cells, then the basal layer. These are the fibroblasts and the blood vessels. Have it in one corner of your mind. Look at this. It is a recall. I hope all of us will be able to recall the lining epithelium. Then this is the stroma, lot of inflammatory cells that are seen. So epithelium, I am correct. Stroma, inflammatory cells. Edema because of separation. And then what is this like? This is another lesion. Here again, I am finding an epithelium that is lining, an epithelium. And this is simply projecting into the exterior. So it is a polyp. The surgeon will be removing it and sending it to us. So it is a polypoidal lesion. It can be multiple or it can be solitary. And in this, there are something called as sporangia. Sporangia means, look at this thick wall, circles, they are all sporangia, within which there will be what is called as endospores. These are inflammatory cells, don't confuse them. So stroma, sporangium, lining epithelium, we are seeing. Still, if it is not clear, look at the higher magnification of it. This is a magnification of the sporangium. So there is the sporangial wall, and lot of these dark circles are all endospores. Sporangium with endospores. So again, the lower and the higher magnification lined by columnar epithelium. There can be goblet cells. Empty sporangia are there. In some, it is filled with endospores. There is the stroma. Stroma means, I told you, always it is supporting the pink tissue in between. And it is filled with dark blue cells, which are the lymphocytes, or if it is ovoid, it is the plasma cell. We cannot make it out at this magnification. Then there is an edema. So quite simple. Almost like a nasal polyp, except that there will be the sporangia and the endospores, as we are seeing in this picture. So this is what we are seeing. A pseudostratified epithelium, then there can be the goblet cells, thick wall, sporangium, the endospores, then there can be the squamous cells over here. So It is a little tricky. If you go to your ENT books, they would have mentioned it as transitional epithelium. From one type of epithelium, it is getting changed to another. So it has got nothing to do with the bladder transitional epithelium. And then, of course, the inflammatory cells. The diagnosis is rhinosporidiosis. So we have seen two conditions. One is the inflammatory polyp, the other is rhinosporidiosis. Let us consolidate. What are your comments on this? What are we seeing? Yes, you are correct. There is an epithelium. We'll forget the nature of the cells, and this is the subepithelial tissue. I am finding large, pale, whitish areas because of edema, dark cells. They are the inflammatory cells, multiple blood vessels, congestion. So it can be an inflammatory polyp. But what if I have these over here? What am I trying to draw? So now it becomes clear. This becomes a sporangium within which I am able to see the endospores. So I would like you people to kindly superimpose one knowledge onto the other so that you people reinforce your memory. And this is the case of the sporangium that is getting ruptured with the dispersal of the spores. It gets dispersed, gets lodged elsewhere or in a different patient or animal and grows into a different polypoid lesion. Gracias.